Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas.
Welcome back to the program. This is Aebhric OKelly. This week, we are in Malta running the iCare course, the intensive care for austere remote environments. And with me is Giuseppe Mercieca, who is our student rep for the next couple of years. And he is a second-year bachelor student. Giuseppe, welcome to the podcast.
Hi, thank you for coming.
So tell us a bit about yourself and what's keeping you busy.
I am a bachelor student getting ready to go on my next clinical placement for my second year. And I'm here to do the further concepts in travel and tropical emergency medical skills. And I am here to support the students who are currently on their courses in any way that they need.
Currently, you're working as part of the staff of college, and you are invaluable with your support for those of us who are teaching, and you're doing a bit of teaching yourself. You have made our job quite bearable for the last fortnight.
Well, thank you for giving me the opportunity. I always enjoy coming down here and seeing how the classes are run, and it's always a good refresher for me to get another view into certain concepts which I might have forgotten.
So, student union rep, what is that? How did you get it? And what is your job?
So when Rod was resigning because he was graduating, the position opened up and I thought that I could fill his shoes pretty well. I enjoy trying to find ways to make improvements, and I've always got ideas that I like to see put through. So if I figured I would give it a go and maybe get in, and it turns out I did. So now I speak to all the students as much as possible, send out emails, I chat to people in person, and I find out any possible way that we can make the students' life easier, whether it's more communication, whether it's getting clarification on certain topics, or just trying to rearrange some of the schedule to improve learning.
So you had to run for the office of student rep. So you had the 125 students we have at the moment, and you got them to vote for you. So what was your campaign strategy?
Mostly I focused on getting a bit more information on things like clinical placements. So you don't really get much of a say at the moment in where you go for your first year, because the college recommends KCMC, which is a good place to go. But then if you were looking to go to other places at some point, it's a bit hard to find out information because not many people have done too many others. So I'd like to find everyone who's been to a different place and get them to write a report, or perhaps get interviewed by you to give everyone else a shot to go somewhere else. And then to focus on student benefits was another one. So quite soon after getting elected, I came up with a document which I compiled a whole list of places where you can get student discounts and places which offered certain perks for being a student. And I put all those into one document which everyone can add to as they wish.
So you are the student advocate, and those of us on the faculty are looking to you to get an idea of the pulse of the students, to see if there's anything we can do to improve and how the college is doing from the eyes of the student. So what have you found? That you have been in this job for a couple of months now. So what is the pulse of the students?
The students really enjoy being able to come to Malta and practice all of the skills that they learn about. Everyone comes from different backgrounds. So one of the key takeaways is kind of getting everyone on the same page when we get here. Some people have much more experience than others, whether it's hospitally or pre-hospitally. Some people might, like myself, haven't worked as a medic prior to starting my education here. So getting everyone to work together well internationally is what everyone enjoys the most, actually, as well. It's the first challenge that people face when they step in the door, getting to work with brand new people, brand new equipment. But then everyone typically says that that's the best part of their experience, is the international cohort coming together and getting to trade information as well as learn from staff.
So as student rep, where would you like the college to go as far as the relationship we have with the students? What's your 5-year plan? What do you want to improve over the next couple of years?
That is a very big question. I'd like to probably still be here in 5 years, but hopefully I'll be graduated by then, but I'll stick around. Having a lot more high-fidelity scenarios is what I really enjoy, and I know the students enjoy that as well. But then also, on the other hand, just the high-quality lectures. Specific training on improvised medicine is one of my favorite things, because I found that being trained to improvise makes you very good at improvising. So I've improvised a couple things at my own placements before, and they've all worked well, but I don't think I could do that without the training on how to do it. And I know you're currently working on creating a few new things that the students can hopefully reap the benefits of for the next couple of years.
Improvised medicine is something that I've been trying to push evidence-based backing. And I'm curious, what were some of the improvised things that you did in KCMC?
I made an improvised chest seal. It was the biggest one that I did. We had a patient with an open wound to the chest, which needed closing. And I was able to improvise with a sterile glove and tape chest seal that prevented a tension from forming while we had time to prepare for a chest drain.
An exam glove.
Sterile glove.
So you cut it open and then you did tape on 4 sides?
I did tape on 3 sides because that was before I was told that it changed to 4 sides, but it worked just fine. Pushed out all of the blood that he had accumulated because he also had a hemothorax because he'd been stabbed. So it pushed all the blood out and then didn't let any more air back in.
Fantastic. And what was the other one?
I can't remember, to be honest. But I know we did a lot of improvised things.
So I was down there a fortnight ago, and there was 3 of you lads, Pietro, Finn, and Grant. So they had come up with an improvised T device for the intubation. Is that something you did as well?
No. A lot of improvised splinting, actually, as well, for fractures. So I was actually taught a little bit of this from Dr. Frank, and we did use cardboard boxes as SAM splints, kind of use them in the same way you use the SAM splints to stabilize fractures before they could go up and get proper treatment.
Were they effective?
Oh, yeah. I mean, especially the stiff cardboard boxes along the length of a lower leg with appropriate wrapping and padding works just fine.
Wrapping with cling film, perhaps?
We used ace wraps.
So would they go out to the skip then and just salvage
I don't
cardboard?
remember where the boxes came from, but as a hospital going through, if you walk around the back of KCMC, you see their open storage, and there are thousands and thousands of boxes of normal saline and all sorts of other fluids, and anywhere in the world, cardboard's easy to come across.
I think there's a paper in there for you if you want to have a discussion on using cardboard for splinting.
Perhaps. Just don't get it wet.
Yeah, so they're staying inside, aren't they? So this is only
it's one of those things you do indoors.
Yeah, unless you did some sort of Scotch Guard spray that you can put on garments to make them water resistant. As an old army guy, there's no such thing as waterproof. I'm very much against that concept. Maybe putting Scotch Guard or some sort of spray, sparkling film. Yeah, that way you can look at the injury, keep an eye on it.
Yeah. Where do you see the college in 5 years?
Oh, you're turning this around on
I
you. No one's ever asked me that. 164 episodes. No one's ever asked me this.
What are your plans?
So you mentioned High-fidelity. I think we are going in that direction. We've been donated a Megacode Kelly Lardell, and we're making that work. And I think using the live casualties that we have, the nurses, the nursing association that we're collaborating with here in Malta, and maybe adding a bit more realism for those. I think we, as a college, we're going to expand some of our programs that are being requested by the students. And this is something you as student rep will need to do. Get a feedback from the students or just get your finger on the pulse of what the students are doing and find what it is that they're missing. So the reason we have 2 master's degrees and a doctorate is because the students were going through the bachelor's program and they wanted more. So it was my intention when I started this nonprofit to run bachelor's Paramedic, and we keep getting asked to enhance our programs, and by doing that, we're then enhancing our faculty. So it's a win-win.
It's one thing everyone always wants. It's always more training, more scenarios, more lectures, more course content.
Yep. So in this iCare here, this intensive care for austere and remote environments, is one of my favorite ones to teach. One student said they wanted more lectures. Another student said they wanted more scenarios. So how do you, as a student rep, address this? So you're going to have 125 different demands from people saying, I want this, and they're going to contradict. So how are you going to deal with that?
Ultimately, we can't make everyone happy is the first response. Making the majority happy and getting everyone on the same page is the big goal. If we can have training that suits the most people, that would be the best idea. So certain people want more scenarios because they don't necessarily get to practice certain basic skills where they are. So most people don't take manual BPs in their jobs. They've got automated ones for them, and they come here, especially if they're from the States, they don't get to use the same IV cannulas or some of the same equipment that we do. So getting everyone to practice using some of the international tools and the more basic tools is, I think, what people want to do more of when it comes to more scenarios. And then more lectures. From a student, I know it's quite hard to listen to hundreds of hours of lectures coming into a course, and especially if you're on your own, you don't necessarily get to talk to other people about it. So getting to hear it directly from the source and being able to ask questions about certain concepts that you might have forgotten to write your question down on can be much more beneficial as well, rather than just watching the lecture over and over again.
So there are people advocating that we go back to all the lectures being in person.
I would think, I see the point, and I think having certain lectures at certain times of the year makes a lot of sense. But as someone who follows my own schedule for studying courses in and out of the normal way of going from 1, 2, 3, 4, 5, I kind of mix and match study 201 and 206 at the same time. It wouldn't really work for me. But if I knew that there were more opportunities to get to some live lectures, I might make a reminder and go back to that one just so I can get it from a new perspective.
I think our flipped classroom is what draws people in. And if we went back to a normal university with one yoke instructing a room full of 30, 40 paramedic students, like most universities, or some have 200 nursing and paramedic students in the auditorium and one guy lecturing. If we went back to that, I don't think some of the people that we want coming would come.
Having the open forum in each module as well makes it very easy for students to ask questions. But sometimes you have quite a few questions that kind of go together, and they would just be better suited to asking someone in person or over a video. It's quite hard to catch some of the instructors. Sometimes everyone works full time, even all the students. So that's one of the unique challenges that the college faces is education and employment at the same time.
So this is not the first time that we've had this feedback from the students of wanting more face-to-face. So this is one reason that I put together the monthly live CoROM conversations, where each month Bill Vashis, myself, and Rod Jordan are available to the students, and we discuss a CPG or a clinical acumen, and then have open questions, and only students and faculty and members of the college are allowed to join that. Is that a step in the right direction, or is that not enough? Or what would you think your student body would want us to do to fill this need?
Absolutely. I think the conversations work out really well. They do nothing but benefit anyone who joins. I'd recommend anyone who hasn't joined to at least check them out. The most recent one, the sepsis one that I got to catch a little bit of, that was highly interesting. And it was also very nice to see a lot of the other students getting involved and asking questions and having things clarified for them. That's what I like to see. The continuation of that, we do the conversations with the dean as well. So students get to hear the updates on the learning material, and the updates to how the material is going to be taught and presented is also a good thing. Sometimes you feel a bit lost. If the only thing you see is your learning material, you don't get to see any of the behind the scenes. And that was one of the big pieces of feedback we got from the first conversations with the dean, was everyone enjoyed getting to see the improvements that are being made, but you don't always tell people things are improving. You kind of want to wait, keep it to yourselves and wait till it's finished and say, oh, look, we finished. This is great now. But people like to know things are in progress. So I think CoROM conversations and conversations with the dean, those are 2 good steps in the right direction. And I look forward to carrying on with them.
And tomorrow night is the welcome discussion to the new BSc students. And you as student rep, I imagine you're going to be in there and meeting these new students.
I am indeed, yeah. I already sent out an email to all of the new students for this year, welcoming them and explaining who I am and what my role is. And I'd like to get to know some of them and hopefully see some faces, and look forward to meeting them in the future.
So who are the people coming and doing our bachelor's program? Who are these people that will want this type of learning?
So from the people that I've met, it's anyone from doctors, nurses, EMTs, paramedics who either work in a civilian setting and have a bit of prolonged transport times or long hallway wait times. So they want to develop some more prolonged field care skills that they can implement in their practice, whether it's people from cruise ships or hospitals, or people who already work in these remote environments and don't feel that their civilian practice skills are quite up to scratch and would like to learn a bit more about how to manage patients in resource-limited environments. And then the other type of students, which is coming through now, is people with no medical background, using this as their introduction to medicine, hoping to only work in remote environments and not really having much of an interest in working in a hospital at home, myself included.
Speaking of yourself, what job are you wanting to get when you finish in a year?
Well, I haven't quite figured out the niche that I'd like to join. I know it's definitely something humanitarian and disaster relief oriented. I'd like to put all these skills into practice to help as many people as possible.
We've had a number of graduates so far, and where are they finding jobs? Or do you know of resources or jobs out there for the remote paramedic?
The biggest resource I know is just other students in general, especially students who are already qualified. They do a lot of work helping other students find employment. There are quite a few organizations who will hire medics for offshore positions or NGO positions working in remote places. Offshore work is quite popular for Europe and Africa as well. And then it's kind of hard to find a job in general these days, but it's just getting online and looking and keep looking.
We have a number of our graduates that finish year one and get their IBSC board certification of wilderness paramedic or flight paramedic. And they do get jobs in the offshore industry, but they've got to go to the UK and get the HSC Offshore Medics course and then get their BOSIT and Hewitt. And then they're competing with people who've been on these jobs for 20 years. And the older fellers are always going to be the ones getting the jobs. So it's tough to break in. That first job is a challenge.
Absolutely, yeah. Especially when you have people who are new to the medical industry and then new to the offshore industry as well. That would be the biggest challenge, which is where I think a lot of our students coming from other backgrounds gives them a really good advantage. Especially people who are already nurses or paramedics or former military, they have a much easier time getting these positions, especially a little bit later on in life. They have a lot more experience to pull from, which I think employers recognize.
My passion, my push, my desire for our students is to be qualified and trained and learned enough that they do very well and are able to find jobs. So as student rep, what campaigns or what information drives would you like to see to give this information or where jobs can happen or what they can do to get jobs for these people who have finished year one, who are qualified paramedics and continuing to go through years 2 and 3?
I would just say if anyone has any resources that they know that they've used in the past, please feel free to reach out and give us a link to any of these job boards. It always helps getting fresh people in. Yeah, from what I've heard, unfortunately, it's quite a lot of volunteering before you can get a paid position because everybody wants a minimum of 3 to 5 years of experience, but nobody's willing to hire you to give you those 3 to 5 years of experience. So it's just a matter of finding the right people at the right time. And obviously everyone comes from different parts of the world. So people from the US have an easier time finding certain jobs in different parts of the world, whereas people with EU registries or people from Asia or Australia have their own kind of niches that they typically keep to themselves.
It's a challenge here in Europe because few countries actually have a paramedic program. Or if they do, like Switzerland and Germany with the Notfall Sanitator, it's a 3-year program, but it's not a bachelor's degree and you can't travel with it. So paramedic, which is called the Notfall Sanitator in Germany, can't really go anywhere else. It doesn't translate over. Whereas Poland and Ireland and UK, they have, well, in Hungary as well, they have degree paramedics that can interchange quite easily. So this is my passion. This is my drive on trying to get paramedics with a piece of paper that will travel so that the bachelor's degree will do that. And that's why we started this whole thing. But there's more countries that are doing nurse on ambulances or just an ambulance driver and a doctor on ambulance. So it is a challenge. So here in Malta, there's nurses on ambulances, which I think, and quite a few nurses I've talked to think that they are a paramedic. I kind of agree. But the local minister of health and the nursing board will never allow paramedics to come to Malta.
Well, it's a shame, but just because nurses have a different title on the ambulance doesn't make them just as specialist pre-hospital providers. I think that's the important thing. They do the same job just because they have a different title doesn't mean they don't have an interest in the same things that we do. And I think working together with different associations is the best way to get everyone moving forward in better working conditions and more jobs. Unfortunately, more jobs doesn't seem to be on the horizon in most parts of the world at this moment.
So Giuseppe, my final question for you is this. What advice do you have for new paramedic students coming onto the college, but more importantly, that a listener out there that is wondering about which is the best pathway for them to get their paramedic or get their ambulance qualification?
If you're not sure, if you want to come and get a degree over here, come for a CPD course and meet the guys. You'll quickly see that everyone who's doing it is having a great time and has a lot of resources available to them. And if you're already a student or you'd like to become a student, once you are, reach out and we can add you to our communities and you can talk to people who are in the course who've been in the same position as you and can answer your questions and point you in certain directions for resources. And we also have the staff members themselves who are a great resource when it comes to knowledge and information, and we'll help each other out. So
that's good advice. And I like the idea of a CPD. So we have so many of our degree paramedics starting out with the short course, the remote EMT, which is a standalone course. It's 6 days with tons of online work. But if they do that, or if they're an EMT with equivalent training elsewhere, they can join and skip RPP 101, which is our first module, and enroll into our degree paramedic program. But people do that. People come in and they're like, I don't know about these yokes in Malta. Who are they? What is this remote and austere medicine? And they'll do this, the remote EMT. So they'll come and they'll get the training, and then they'll see the level that we teach, and that hooks them. That makes them want to come back. And for example, the UN send their ETB instructors, emergency trauma bag instructors, who must be an EMT level, to us to get qualified. And we have been doing this for about 7 or 8 years. And we've had their UN medics come through again and again and again, because they see that we're pushing for evidence-based medicine, and their remote EMTs are better on the job in Somalia or wherever they are, because they have experienced this. So you're right. For those who are interested, just come do the REMP course and have a go.
Absolutely. We have a student currently, and we had one last week as well, who are only here for CPD courses, and they enjoyed it so much that I'm getting emails and WhatsApp messages about becoming a bachelor student. So come and have a look.
And that goes with the masters as well. We've had people come through our iCare or APIS courses or TTAMS courses, and they're already a nurse, doc, paramedic, and they see what we're doing, and they didn't realize that we do a master's of austere critical care. And sure enough, they're like, I like this and I want more.
Yeah. Especially certain guys from the States who would like a more clinical master's rather than a more theory-based one. That's what we offer.
Yeah, and we have a U.S. paramedic this week on the iCare course who's doing this as part of his master's of austere critical care, and he used the benefit of not needing a bachelor's degree. So here in Europe, you only need an associate's degree to enroll into our master's programs. So if you're an associate degree level paramedic, you can skip the bachelor's and come on and do one of our master's programs. Any last thoughts?
Stay safe.
Giuseppe, thanks for being part of our faculty, and you are definitely making my week here easier by being part of the team.
Thank you very much for having me.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at corom.edu.mt.